Hello, I am Umanath. Welcome to Preventive Healthcare. This video will focus on the senior citizens, the elderly people, those who have crossed the age of 60. What kind of risk that they are facing in terms of lockdown? The perspective is how their health is going to be affected, and if so, what steps we need to do it proactively to protect the health of our senior people. And we will see these things in this video. And we all know that the lockdown due to coronavirus threat is being extended step by step by various countries. And this extension of lockdown and people confining to their house can have significant impact on the health of individuals. There are different age groups of people: children, boys and girls, teenagers, adults, and senior citizens who have crossed the age of 60. Which group is highly vulnerable? Which group is going to face high level of risk? I think we all need to understand. The senior people are going to face the maximum risk. Do you know why? Let us take a simple example of children and aged people and their metabolism. See, children are very active and their metabolism is at a very high level of active phase. As we age and reach middle age, the metabolism moderates. But the senior citizens, their metabolism is comparatively slow. So when the metabolism is slow and when they are in a lockdown condition, it actually slows the metabolism even further. When this happens, the impact is going to be very significant for senior people than the children and the middle-aged people. I feel all of us have to understand the truth behind it. How do we help the senior citizens to face this particular unique situation? To give a simple example, I think we've all seen some old cars, vintage cars maintained by some people, and they are still running it. And sometimes we wonder how well that car is maintained when compared to even our latest cars. And the secret is they have a periodic maintenance. They also have a periodic servicing, which is done at interval. And that ensures that the car is in a very good condition and it is still running without any problem. And all of us pay attention to maintaining our devices like cars, appliances, even house. We take a lot of effort to maintain. But when we maintain, the lifespan of the device increases. And the quality also is maintained over a period of years. Actually, are we doing it to ourselves? This is very important as we age. An aged car needs more maintenance. Same way, when we age, we need to focus more on preventive steps rather than reactive steps. And let us understand that prevention is better than cure, not only for your car, it is also applicable for our body. Now, let us look at the senior citizens in the current situation. We have two sets of senior citizens. One group, they were all active in terms of their day-to-day routine. For example, like walking, doing their own activities, and they were very conscious and all steps they have been doing to maintain their health. In fact, you can see them in the park or in the places where people walk every day. All these things were happening prior to the lockdown. Now, this is not there because they are all confined to the houses. The second group of senior citizens, even before the lockdown, their activity level was less. So, understand that the lockdown can have impact on both the groups. The lockdown can have impact on senior citizens who were active earlier. At the same time, lockdown can have more significant impact on the group of senior citizens who are less active earlier, now even more less active. How it can impact? Again, take the same example. A vehicle that is parked in your parking space, which is not running the last 1 month or 1.5 months due to lockdown, and the condition can deteriorate if it is not in use, if it is not maintained. And the same thing applies to us. So, and the impact is really important for senior people. So when the activity is reduced, I mean when the physical activity is reduced, and that can slow down the metabolism even further. As the metabolism slows down, the impact is going to be an accelerated degeneration. When you say accelerated degeneration, the bone and joints can degenerate faster and can become less flexible. And the body can start getting some indications of tiredness, weakness, pain gradually. And it can also have an impact in terms of the day and night balances, something like sleep disturbances. It can have impact in terms of the digestive system, where they may start feeling that lack of appetite, lack of taste, and not willing to eat well, and increasing transit time. That means in and out, where the bowel movements can become erratic and constipation may also start appearing. So these are some of the points which I wanted to say, what kind of impact they are likely to see. To re-emphasize, there are 4 groups of symptoms or issues which can become very predominant with the senior citizens. First group is related to tiredness, weakness, low energy level, and all these symptoms. Second group is pertaining to body pain, muscular discomfort, stiffness in the fingers and the wrist, stiffness in the knee, sometimes mild kind of a pain in the feet and the ankle, and any kind of a discomfort in the bone and joints anywhere in the body. This can gradually increase if the physical activity is reducing gradually. And in the digestive system, the third group, the issues like lack of appetite, unable to eat well, constipation, irregular bowel movements, all these issues can gradually increase. And some people can also notice some kind of a swelling in the legs or swelling in the feet or in the ankle also due to prolonged lockdown. And sleep disturbances can also appear. So what it indicates, as we age, our body degenerates. Now, when you are reducing the physical activity, it can degenerate even faster. So we need to take all the important steps to control and reduce the effect of this kind of situation. How do we do it? So I give you certain simple and easy to follow steps so that you can handle the situation easily. First point is that ensure that all the moving parts in your body are moving every day. It can be done by simply doing some walking within the house if you have space, or doing some simple stretching exercises for a few minutes, maybe around 15-20 minutes in a day, in the morning and again in the evening. That will definitely ensure that your moving parts are moving, and that is very important to keep the metabolism at a decent level. Second important suggestion is All are simple suggestions only. Ensure that whatever food that you are taking, the food is served warm. Warm food helps the metabolism. It also helps to ensure the required warmth and flexibility in the body. So ensure that you are taking warm food. Don't take food that is very cold. Third is, every day, definitely in the evening, taking a hot water bath helps you to maintain some amount of flexibility in the body, and also it helps you to energize your skin. And this can help you to even sleep better in the night. This can also help you to get up comfortably in the morning. So this is another simple step. Hot water bath in the evening. Do not use cold water. Then the fourth step, which is very important, is you are ensure that you take adequate supplementation. The supplementation which can help to improve and reduce the symptoms that whatever we have discussed. Supplementation will help you to improve your health, at the same time reduce your symptoms so that you become better. So some of the important supplements which can help are omega-3 like fish oils, and vitamin E which can help your skin and reduce aging, and a calcium citrate with a combination of vitamin K2 that will help you to strengthen your bones, and certain supplementation like glucosamine which will help you to bring in flexibility in your bone and joints. So these are important ones, and of course vitamin D3. And I am not listing many because I am trying to list something very simple and easily available which can address most of the symptoms and reduce your discomfort and pain and any other disturbances in your systems. And you will not have any harm or any problem in taking this supplementation. It may not have any clash with any of your essential medication. For example, if you're already taking some essential medication like medication for high blood pressure or medication for diabetes or medication for thyroid conditions and so on, you can continue parallelly and follow these recommendations. Still, you will be able to get the required benefit. Do not discontinue your essential medication. Please continue as recommended by your doctors. And with respect to the food, try to follow simple and easy to digest food. Try to follow simple and easy to digest food and ensure that you are taking all the inputs, including some amount of protein like eggs or dark chana or dal or any other forms of vegetarian protein, which is also important for you to maintain your muscle strength, for you to remain pain-free in the body. It is definitely important. And also take enough fruits and cooked vegetables. I suggest not to take raw vegetables or salads for senior citizens. Better to take them cooked. Fruits can be taken as it is. The reason why I say so is that raw salads or uncooked vegetables can cause more disturbance to people like you when the metabolism is slow. So better to take cooked vegetables. Okay. This is also a practical and a simple suggestion that you can implement. Okay. So be conscious of all the facts that we have discussed in the video and ensure that you are practicing these things at home. When you practice these steps at home, you are in a better position to handle this lockdown situation, even if it is extended. And it will also help you to come out comfortably when the lockdown is lifted. Okay. And I also have a part 2 for this video, which will give a little more details that you can follow. And if you find this video useful and helpful, please subscribe. And I am trying to address all the age groups so that they can all get benefited. Overall, the intention of preventive health care is to provide inputs which are preventive in nature that can serve you from cradle to grave, all the age groups, for all kind of issues. And I am trying to give it in a step-by-step manner so that the duration is less and you're able to understand easily. Thank you very much. I'll see you in the next video.